Hello, I talk about outcome after the maternal cancer diagnosis during pregnancy. I study Catholic University. My subject is technical English. My topic is pediatric outcome after maternal cancer diagnosis during pregnancy. My teacher is Sia Moscoso and my name is Mariana. Introduction. Cancer during pregnancy is uncommon, occurring in approximately 1 out of 1,000 pregnancies. Because of this, both doctors and women were often unsure about how to deal with cancer during pregnancy for many years. However, as more women with cancer are deciding with a doctor to start or continue treatment while pregnant, more information about treating and relieving cancer during pregnancy is available than ever before.
There does not appear to be an increased risk of dying. Even when the tumors are fed by estrogen, some of the analyses did not show an increase. But it does appear to be somewhat related to the timing of the pregnancy after the diagnosis of breast cancer. So the longer you wait from the time of diagnosis, the decreased chance of dying of your cancer. And therefore, we often recommend for women to wait approximately 2 years after the diagnosis of breast cancer before we consider that. Certainly, we don't want women to get pregnant while on tamoxifen therapy because that is also associated with a significant risk of birth defects. And we think that if you wait at least 2 years, that may be associated with a decreased risk of dying of your cancer, but also most of the very aggressive recurrences that happen in young women happen in those first 2 years, and that would really complicate treatment if you are pregnant at the same time.
Updating. Know the proper treatment for cancer in pregnant women.
Because cancer is largely a disease of older adults, it is not common in pregnant women. Cancer affects approximately 1 in 1,000 pregnant women. The most common cancers found during pregnancy are the same as the most common cancers found in non-pregnant women during childbearing ages: breast cancer, cervical cancer, leukemia, lymphoma, melanoma, ovarian cancer, and colorectal cancer. Diagnosing a new cancer in a pregnant woman is difficult, in part because any symptoms are commonly assumed to be a normal discomfort associated with pregnancy. As a result, cancer is typically discovered at a somewhat later stage than average in many pregnant or recently pregnant women. Some imaging procedures, such as MRIs, magnetic resonance imaging, CT scans, ultrasounds, and mammograms with fetal shielding, are considered safe during pregnancy. Some others, such as PET scans, are not. Treatment is generally the same as for non-pregnant women. However, radiation and radioactive drugs are normally avoided during pregnancy, especially if the fetal dose might exceed 100 cg. In some cases, some or all treatments are postponed until after birth, if the cancer is diagnosed late in the pregnancy. Early deliveries to speed the start of treatment are not uncommon. Surgery is generally safe, but pelvic surgeries during the first trimester may cause miscarriage. Some treatments, especially certain chemotherapy drugs given during the first trimester, increase the risk of birth defects and pregnancy loss, spontaneous abortions, and stillbirths. Elective abortions are not required and, for the most common forms and stages of cancer, do not improve the likelihood of the mother surviving or being cured. In a few instances, such as advanced uterine cancer, the pregnancy cannot be continued, and in others, such as an acute leukemia discovered early in pregnancy, the pregnant woman may choose to have an abortion so that she can begin aggressive chemotherapy, without worrying about birth defects. Some treatments may interfere with the mother's ability to give birth vaginally or to breastfeed her baby. Cervical cancer may require birth by cesarean section. Radiation to the breast reduces the ability of that breast to produce milk and increases the risk of mastitis. Also, when chemotherapy is being given after birth, many of the drugs pass through breast milk to the baby, which could harm the baby.
Diagnostic. Being pregnant after daily is a cancer diagnosis because some cancer symptoms such as abdominal bloating, frequent headache, or rectal bleeding are common during pregnancy and are not considered suspicious. On the other hand, pregnancy can sometimes occur. For example, a patient done as part of standard prenatal care can detect cervical cancer. Similarly, an ultrasound performed during pregnancy can find ovarian cancer that might otherwise go undiagnosed.
A man discovered he had cancer by taking a pregnancy test. Hi everyone, I'm Sandra Matos with all the details here for you on I.O. What do you love most about life? I love traveling, going to see new places, learning about new cultures. 19-year-old Byron Gildard also likes to get away, but when he came back from holiday in August, he had a pain in his side that he just couldn't ignore. After going to go see his doctor, a mass was found in his abdomen. He sent him to go for an ultrasound. Now, before he went away, he was getting this pain in his side, and he did go see his doctor, but the doctor attributed it just to muscle pain because he used to work out at the gym. When he went for the ultrasound, scans showed that he actually had a tumor which was spreading into his lungs. It was cancer, but they weren't sure which type. He was asked to provide urine for a pregnancy test in order to determine if he was producing the same kind of hormone that is detected in pregnancy. This would be a hormone that is linked to both pregnancy and testicular cancer. Wow, you learn something new every day. Who would have ever thought? I thought pregnancy tests were just to find out if you were pregnant. The pregnancy test unfortunately came back positive and he was diagnosed with stage 4 testicular cancer. It had spread to his abdomen and lungs. He was sent to chemotherapy the very next day. While going through chemo, the hospital would monitor the hormone through blood tests. It was gradually declining, which was great news, and the tumors were shrinking. Byron had surgery to remove the growth in his abdomen, a testicle, and the lymphatic system behind his stomach. In January, tests after the surgery showed that Byron was cancer-free. Yay! I'm so happy for you, Byron, and your family too. Now he's living life to his fullest. He's actually getting into stand-up comedy about testicular cancer to show people that it's not a death sentence and to educate people further on it. So tell me, what's something you really want to do in life? Jump out of a plane, go bungee jumping, go on that scary ride at the amusement park? Let me know in the comments below.
Some cancer treatment may be used during pregnancy, but only after careful consideration and treatment planning to optimize the safety of both the mother and the unborn baby. This could include surgery, chemotherapy, and radiation therapy.
Women who are diagnosed with breast cancer during pregnancy have tremendous additional strain due to concern for the safety of the unborn child. It is a traumatic and extremely difficult situation, but there is still hope because of the many treatment options available. If you are pregnant and have been diagnosed, be sure to communicate information about your pregnancy to your doctor. Your medical team will take extra care in designing the treatment plan that best controls the breast cancer while protecting your unborn child. Your treatment plan will depend on the size of the tumor, its location, and the term of your pregnancy. As with women who are not pregnant, surgery is the first step for treating early-stage breast cancer. Surgery during pregnancy carries little risk to your unborn child, So your medical team will most likely proceed by removing the lump and possibly some lymph nodes from under the arm with a lumpectomy or mastectomy. Chemotherapy may be a treatment option depending on your cancer type and the stage of your pregnancy. The effects of hormone therapy on unborn children is not entirely understood. Because of this, if hormone therapy is prescribed, it will most likely be used only after the baby is born. Although the cancer cannot spread to and harm the unborn child, sometimes the best treatment plan for the mother may put the unborn child at risk. These decisions will require the expertise and consultation between your obstetrician, surgeon, medical oncologist, and radiation oncologist. You will also need the emotional support of family and friends, and may benefit from the professional assistance of a skilled counselor or psychologist.
Conclusion: children who had prenatal exposure to cancer and the associated stress imaging studies and treatment had normal development during testing at 18 months, 36 months, or both. In particular, chemotherapy had no clear adverse effects on postnatal growth or on cognitive or cardiac function. Our data suggests that the diagnosis of cancer during pregnancy is not necessarily an indication to terminate the pregnancy.
Pregnancy is supposed to be a joyous and exciting time of your life, right? Well, for one Tampa Bay woman, pregnancy has her also fighting a battle. Our Jason Beisel tells us about a woman getting ready to give birth, all while fighting to save her own life.
Hi, how are you feeling?
Good, how are you?
Good. How's the baby?
Good.
For a time, Ashley Gale Booth never thought she'd be at an appointment like this one, her final prenatal checkup before giving birth to her first child.
I just didn't expect it to be so soon.
Doctors initially told Ashley she wouldn't be able to conceive.
Something about my ovaries or something, I don't know, and I had endometriosis, and they say that makes things difficult, so.
In March, Ashley beat the odds and became pregnant. Just 2 weeks later, she made another unexpected discovery.
I was just putting like the lotion on to prevent like stretch marks and stuff, and I had felt the lump in my left breast.
A biopsy revealed cancer in her left breast, muscle, and lymph nodes.
When I came back, I was just like, okay, well, what do we do now? I want to know what's next.
Her treatment involved a mastectomy and chemotherapy, which she didn't agree to until learning it wouldn't affect the baby.
Because it didn't pass through the placenta, and because the baby's spinal cord and all of that was closed.
Ashley will be induced on October 4th, 8 weeks early. Doctors have been injecting steroids into the baby's lungs to make them stronger so he can breathe on his own. The early due date will give Ashley and her baby son a better shot at avoiding complications.
I just want him to be okay. I'm not worried about anything else.
Ashley still faces additional surgery and chemotherapy, but looks forward to watching her son grow and hopes to give him a sibling sometime in the future.
I couldn't get through it without God, that's for sure.
Jason Beisel, ABC Action News.
Thank you.